You are listening to the
World Extreme.
World Extreme Medicine.
The World Extreme Medicine
Podcast.
Today, we are going to discuss how NASA researchers are using the One Health concept to look beyond the immediate to understand the broader implications of climate science on global health. I have special guests here with me today, John Haynes and Dr. Helena Chapman. John Haynes is the program manager, and Helena Chapman is the associate program manager of health and air quality applications in the NASA Earth Action Program. John received his master's in meteorology from the University of Oklahoma and bachelor's in meteorology from the University of South Alabama. He also serves as the chair of the Geo-Earth Observations for Health Initiative and GeoHealth Community of Practice. Helena received her PhD in Public Health, One Health, and Master's of Public Health in Public Health Epidemiology from the University of Florida, go Gators, and her MD from the Ibero-American University in the Dominican Republic. And so, John and Helena, I can't thank you enough. Thank you for being here with me today, and thank you for joining us on the World Extreme Medicine podcast.
Thank you so much, Sarah, for having us.
Thank you, Sarah.
Mm-hmm. It is our pleasure, truly. And so as I understand it, the One Health concept recognizes the health of that humans, animals, and the environment are all interconnected. And so how does NASA Health and Air Quality, how does the team define and apply the One Health concept in practice? And why is this important, especially now?
Well, thank you, Sarah, for that question. As you said, the One Health concept is really looking at that, we have to look at human health, environmental health, and animal health in a completely holistic manner because they are inexorably connected. And in order to truly understand the global health challenges that our planet faces, we have to apply that One Health concept because you cannot look in a vacuum at just human health, animal health, or environmental health alone because they all interplay with each other. And this concept is adopted by all the agencies of the federal government that work in this area, particularly, for example, the CDC, as well as the World Health Organization. And all of the projects that are funded through our NASA Health and Air Quality portfolio really exemplify that work. Because for us at NASA, it all comes down to it all really starts, I'll say, with our unique vantage point from space, because we in NASA Earth Science have over 20 satellites and sensors in Earth's orbit, including some on board the continuously crewed International Space Station, that are continuously monitoring the Earth's weather, climate, and environment for research and applications purposes. And every day we download something like 25 terabytes of data on the Earth system and how it is changing from this constellation of satellites. And many of those data sets are really crucial for health and air quality work. That includes information on air pollution, land surface temperature, ocean surface temperature, vegetation density, wildfires, precipitation, just to name a few. And the really cool thing is that all of this data that NASA gets from this immense satellite constellation is free. It's all free. It's free and open access to everybody across the globe to be able to work and investigate the Earth system and how it is changing and how that affects our health and the very air we breathe.
That's exactly right. Many of the projects that are within our portfolio are allowing those types of disciplines that typically don't work together on a daily basis. And so you have those who are experts in earth science, you have those who are health practitioners, you have those who are ecologists, those who are computer science experts, those who are working with atmospheric composition and some very robust satellite and algorithm, different types of models to put in together for mathematical calculations. And so this is the beauty of being able to integrate these disciplines outside of our silos to gain a more holistic perspective on the changing Earth systems and how those changes are impacting over time and space, but also what does that mean forthcoming? And that can really put that information into the hands of those people who need that information, whether it's the local mayor or the community leader or that congressperson. It could also mean the school teacher or that clinician, those who are working directly with some of the community members or those who are making those decisions. So that's where that information can be extremely important to how we navigate some of these challenging environmental health concerns that we're seeing moving forward. So that's really being able to get out of our silos is really the most important part when we think about the One Health concept.
Absolutely. Absolutely. I love that. That is a fantastic description of the collaboration, like not just national, but international, and the implications for the Earth as a whole. And so I mean, we touched on your degrees and your training, but like Helena, how did you train specifically for this role, and like what degrees or certifications or internships, like how did you end up in this role?
Sure. Well, a little bit of good timing and preparation to really think outside the box on where your career can go. I was trained in human health disciplines. So I studied public health, epidemiology, in particular related to vector-borne disease transmission in the Caribbean. I followed that by moving to the Caribbean and then being able to study medicine and really what are those physiological processes that impact human health. And then that got me to the next step where I really was still inquisitive to how I can use that to do better research and practice. I didn't exactly know what that meant at the time. But in the public health world, that typically means a CDC or a WHO, depending if you would like to work locally, statewide, nationally, or internationally. When I did my PhD learning about One Health, I was trained in the lab, collecting mosquito and tick samples, going to different types of animal production facilities such as poultry and slaughterhouses, learning about food safety and food quality, going to the milk production areas to look about milk production as well as just food safety in those regards. Having all that information was just eye-opening to me, being trained as a public health professional and clinician. And then there was an opportunity to be able to expand that, being able to do a Science Policy Technology Fellowship, being placed at NASA, where the work that I had done from dengue fever to respiratory diseases such as tuberculosis, and now place it in a different angle with using satellite data. Now, satellite data cannot be used for all environmental health topics. There has to be an environmental parameter that can be remotely sensed from low Earth orbit to Earth, as we're seeing some of those changes within our health system, within our Earth systems. And so I was able to really get a very steep learning curve when I joined NASA a few years ago, but I was able to, with that One Health approach, really think, this is my expertise, being to our team. John is a meteorologist. I was able to learn from him and see really this vast resource of satellite data that is not as well known within the health community. Certain pockets of specialists are using satellite data, but on the whole, that's something that we can really learn on how we can do better data integration. So the on-the-ground data, our go-to is health surveillance data. How can we be able to expand that to other data sources that can help us really build that holistic picture of some of these changes within our Earth systems and how that will impact human and animal health?
Brilliant. I thank you very much for that. That was very thorough, and I think it's important for people to understand, especially like an aspiring young scientist who looks at you and says, I want to do that when in my career, how do I do that? And seeking out opportunities at the CDC and with World Health Organization are good places to start. And so, John, tell me a little bit more about how you got into this field and what kind of training and certifications you needed to have, or internships and experiences.
Sure, Sarah. And I just want to preface this by saying, building off what Helena said, as she mentioned, I'm a meteorologist. My degrees are in meteorology. Helena has a PhD in One Health and a medical degree in MD. We really exemplify the One Health concept, that we have, everybody. Like I said, that in order to truly tackle our global health challenges, you have to work in this interdisciplinary way. You have to have satellite remote sensing experts, meteorologists, climatologists. You have to have epidemiologists. You have to have medical doctors. You have to have socioeconomists. You all have to be working in this team in order to truly tackle the issues that we face globally. So with me, my meteorology background, when I graduated from the University of Oklahoma from grad school, I had, done everything from storm chasing and investigations on how thunderstorms developed and evolved across the southern Great Plains. And I got hired into NASA to actually manage the aviation weather program for the agency, which I did for many years. But in 2004, my boss came to me and he said, I have a new opportunity for you. He said, I would like for you to take over the health program because the person who has been running this program is moving to a different position. And I said to my boss at the time, I said, you may have misunderstood me for the past couple of years. I'm a meteorologist, not an epidemiologist. And he laughed and he said, it's all the same data. It's all the same weather and climate data that we get from our satellite constellation, just used in a different way. He said, and you'll learn, you'll catch on, which, as Helena said, the fire hose began for me to have to get up to speed on all of these issues of environmental health, infectious and vector-borne disease, and air quality issues. But it has been so gratifying because I've been lucky enough to be managing this program now for almost 20 years. And as a meteorologist, we've been using satellite data to inform and monitor and predict weather since the launch of the very first weather satellite, TROS-1, in 1960. So that's a very mature field, very comfortable with it. People understand using satellites to predict the weather and monitor the weather, predict where hurricanes are going, et cetera, and so forth. But really using it for health issues, when I started in this program 20 years ago, that was a new field. That was just really beginning to start clicking in people's minds. Hey, we can use this environmental data, this climatological data, this weather data to help inform health decisions. But it was a really brand new field. And I feel like Helena and I have been able and had the wonderful opportunity to work in a space where I think it's really the golden age right now of using environmental observations, particularly from our unique vantage point in space, to be able to inform these global health challenges that we face today.
I mean, it definitely makes me feel safer knowing that there's a physician and a meteorologist working together to coordinate all of this. I mean, it is such exciting stuff. What a cool field and a cool team to have put together. And so I'll send this one to you first, Helena, and then John, I'll have you answer. But so walk me through what's a typical work day or work week for you, because I'm sure every day it's different. But so how does your day or your week unfold with regards to this concept?
Sure. The beauty about it is that each day is different. Some days are very, very busy with different meetings where we're talking with our NASA-funded researchers, with our own team within the Earth Action community, with specific stakeholders, with our own team, and even with some of our interns. So we have different conversations with many of our team members on a regular basis. Some days we are being able to do different types of community engagement with schools of public health. Obviously, we do travel a lot with different conferences, so there's different types of engagements that we're able to do with different audiences. And my favorite, because my home community is a health community, I really enjoy and embrace the opportunity to be able to share the knowledge that we have gained over the last few years, decades, to be able to share that with those who are now that next generation, who are very inquisitive about what we can do, what are those tangible skills that they can learn, not just from textbooks, but getting out in the field. And I think that One Health really offers that opportunity to think outside the box. For example, malaria has been a disease that we've seen, for decades, with its ups and downs, depending on different types of strategies that have been used in the field. We're looking at now more technological advancements and different elements from the biology of the vector to even, vaccine development. But we still have this challenge, and it is still one of the top 3 causes of mortality due to a single infectious agent. But are we really using satellite data to help understand not only the vector biology, but also where are these transmissions going? Are there different species with some of these changing and expanded environments? Are we seeing where those are going? Because increased temperatures does affect vector geographies, right? Including increased precipitation. So being able to look at some of those, that's something that we talk with our researchers about to be able to better understand some of their work. And we do be able to fund some of those research projects that are looking at, for example, vector-borne disease like malaria. So those are constantly helping us being able to share this information with some of that new generation who are coming up and learning and may choose to go into infectious disease. They may choose to go into different types of atmospheric sciences and potentially some training opportunities within NASA. NASA has a great opportunity for RSET courses, which are basically continuing education courses that are free, often sometimes in different languages. They're recorded, and anyone can use them leisurely to learn a little bit more from the introductor and how do I even access the data to more complicated algorithms of using some of the satellite data. That anyone can use to be able to learn more about it. But then there are other internships that are available where you can work directly with NASA scientists and researchers through programs such as Develop. That's an internship that you can apply for throughout undergrad, graduate school, and even transitioning professionals who are looking for a different career. So there are a lot of opportunities that we're able to share with some of these new generations that are coming to be able to provide some of that innovation to some of these complex challenges that we're seeing. We also travel to many conferences for different target audiences. If we go to the American Public Health Association, we are interacting with different public health professionals of different disciplines. If we go to the American Thoracic Society, we're connecting with many basic researchers with different types of animal models, but also with clinicians, so physicians, nurses, respiratory therapists, and other allied health professions. And if we go to the American Geophysical Union, we will be around many who are studying the Earth systems, Earth and space sciences. So we're able to engage with different audiences, bring our grantees to be able to share their expertise, and hopefully be able to engage and leverage this expertise to a greater dialogue on how we could advance science. One of the elements within that is that we're able to look at how we can broaden the science by bringing some of this to different disciplines. But it is understood that being able to have these extensive dialogues within the disciplines is important to advance the science. So dually, it's important to advance the science as well as broaden it across. And so that's some of our engagement that we do on a daily basis. In addition to programmatic responsibilities that may be a little less attractive than travel, but it's a great opportunity to be able to talk with our PIs, our researchers, and make sure that we're able to assist them while they meet their milestones for their proposed projects throughout the solicitations that NASA offers.
Very good. And how would someone access that? Is it available on nasa.gov and in the drop-down menu, data or classes?
Yes, it is all available. And in particular, one of the great resources we have upcoming and that continues to be remodeled is the earth.gov. It's the Earth Information Center. That is an interagency collaboration with a lot of resources from data to even learning more about different elements. There are 9 specific themes ranging from wildfires and air quality to biodiversity. And so we encourage all of your listeners to be able to look at earth.gov. It is the hybrid platform to an in-person exhibit that we have currently right now at NASA, located at NASA headquarters, but it is an interagency development. But everything is available and can be found on nasa.gov.
Okay, great. And then, John, how about you? What's a typical work day or work week for you? It's probably you're working together, so it may be quite the same.
Well, Helena summed it up that there's no typical day or typical week. But, as a meteorologist, that's what I expect. There's no typical day of weather, and weather changes every day. And that's one of the reasons I love meteorology, because you're never going to be bored. And I'll say that our job, managing the health and air quality program at NASA, is much the same way. You're never going to be bored. I am lucky enough. I tell everybody, there's 2 things that everybody in the world wants to talk about. They want to talk about the weather, and they want to talk about their health. And I'm lucky enough to have a job that actually combines the 2. So you have no limit of opportunities of people wanting to be involved, wanting to be engaged, wanting to learn more about it. Fundamentally, our mission in health and air quality is to enable people and organizations to apply insights and accelerate impacts from Earth science, particularly from our satellite data, to benefit the economy, health, quality of life, and environment. And fundamentally, we execute that mission through our partners, stakeholders, and end users. We work hand in glove with them in order to co-develop these projects, to answer their challenges, to answer their needs of how can satellite data help us make better health and air quality decisions for management reasons, forecast reasons, or policy decisions. And I don't know the exact number, but we have hundreds of stakeholders and end users that we interact with every day, every week, from across the nation to across the globe. So I'll say one of the most exciting things that we do are these brainstorming activities and these collaborative activities with our stakeholders. And again, those range from all the way from state departments of health and state departments of environmental quality to the CDC or the EPA or to the American Red Cross or to the World Health Organization. And so we'll sit down with them and say, what are your challenges? What are the big things that keep you up at night? Where do you see the world in 5 years? So they inform us about their needs. And then we say, okay, well, we have these capabilities. Maybe you could need precipitation data that we can obtain from our satellites. Maybe you need more information on land surface temperature. Maybe you need information on socioeconomic factors that we actually have an entire NASA data center looking at socioeconomic factors worldwide. And then we can pull those together, working with their team to come up with a solution of how to use this immense and treasure trove of environmental data to help inform their decisions. So that's the most exciting part of our job to me.
100%. And how does NASA monitor and track these changes?
It all comes back to our unique vantage point in space. So like I mentioned earlier, over 20 plus satellites and sensors that are in Earth's orbit that are continuously monitoring our planet. And through that information, we're getting a global picture. Now, we combine that global satellite picture with ground measurements as well. So you have to look again, as the Earth is a system, you have to look at this data as a system as well. So we have observations from the ground monitors across the planet, from ocean buoys, from aircraft, all the way up to orbit. But you have to look at all those to build a representative model of the Earth system, and then be able then to use supercomputing capabilities to run these very complex Earth system models to see how it's changing and then predict how it will change in the future. But it's really that holistic view. But for us at NASA, particularly, it comes from our satellite data, because while ground sensors are invaluable, they only give you information about one point on the Earth. But through our satellites, we're able to get a picture of the entire planet and areas where you could never have ground sensors, such as the middle of the Saharan Desert or the middle of Antarctica or the middle of the Amazon rainforest. So we're able to really get information that would be nearly impossible to do with ground sensors and other means from our satellites.
And what trends, like recent trends, have you observed that could impact human and animal health?
Well, the number one thing I'll discuss here, of course, is the issue of climate change. And air temperatures on Earth have been rising since the Industrial Revolution. Human activities, particularly emissions of heat-trapping greenhouse gases like carbon dioxide and methane, are making our planet warmer. Heat waves are one of the clearest examples of the impacts of humans on our climate. And it's just a fact. Earlier in the spring and extending later in the fall. When you think about it, the climate crisis is really a health crisis. In fact, the CDC estimates in 2023 that over 2,300 Americans were killed by heat. Heat is actually the most deadly weather phenomena in the United States. It kills more Americans than any other weather phenomena, more than tornadoes, more than hurricanes, more than floods. And a lot of people don't realize that. And unfortunately, those numbers just are simply on the rise.
So yeah, we just touched on the connection between the rising global temperatures and the increase in these extreme weather events. And Helena, would you like to touch on how these events influence public health? Or we mentioned earlier the correlation between increasing temperatures and vector-borne diseases.
Yeah, and as John had alluded to, the research continues to demonstrate that there are examples. The fifth National Climate Assessment was just released this year, demonstrating that there is clear evidence that climate change is occurring, a clear statement. And that demonstrates now we have the evidence-based science to base up those next steps. Some other fundamental documents have also come out this year, the National Vector-Borne Disease Strategy, some other, including the World Economic Forum's Had a Global Risk Report that also came out, among many others, including from the World Meteorological Organization, and last year, the One Health Joint Plan of Action. And so these guiding documents really allow us additional opportunities to identify what the literature is saying right now, what are some of these key findings, to then use that to identify where the gaps are. And then from there, from those gaps, how can we fill them? The One Health Joint Plan of Action is something that I use. I constantly look at that to identify some of those potential tangible activities and deliverables that we need to make some of our work more operational. We talk about One Health a lot, but the challenge that we have globally within our community is how can we make that more operational? And so the quadripartite organization was able to work on this joint plan of action this past year, not only being able to revise the definition, make it more operational, but also develop this plan of action that we can use globally to frame some of the work that we're doing across, especially as we're looking in this decade of action leading up to the 2030 Agenda for Sustainable Development.
And so we touched on heat, but what are, through your research and your observations, what are some of the most significant health risks, like globally, beyond heat and beyond, malaria or vector-borne diseases?
Well, as I mentioned, when you're talking about climate change, pretty much every facet of climate change has a human health impact. Rising temperatures, more extreme weather events, rising sea levels, increasing levels of CO2 in our atmosphere have impacts on extreme heat, as we've mentioned, but also on water and food supply, water quality. It changes in vector ecology and geographies that Helena mentioned, and also changes in aeroallergens and air pollution. So maybe I'll touch on the air pollution one, because again, that affects the very air we breathe. And we know from the World Health Organization, air pollution is considered the silent killer. They estimate that there's over 7 million excess deaths from both outdoor and household air pollution worldwide every year. So when you're talking about air pollution and climate change, one of the things that first comes to mind is the issue of urban heat islands. And so it does tie back to the heat issue. Urban heat islands are caused because our cities are made up of bricks and concrete and asphalt. And those materials really love to absorb incoming solar radiation and are slow to release it at night, making cities hotter than the countryside during the day, but even a bigger difference at night, not allowing the cities to cool down at night as much as the surrounding countryside. And of course, we know the heat stress impacts on humans from that. But within our cities, there's a particular pollutant known as nitrogen dioxide, or NO2. And nitrogen dioxide is a pollutant that is monitored and regulated by the EPA under the Clean Air Act. It comes from smokestacks and tailpipes, from factories and cars, from the burning of fossil fuels. And NO2 is harmful to breathe on its own. But when you expose it to sunlight, it actually will break down into ozone. And so sunlight and heat on NO2 makes it become ozone. Ozone we love up in the stratosphere, where it protects us from the sun's UV radiation, but we don't like it down here at nose level, where breathing in ozone at the surface level causes lung inflammation, throat inflammation. It is very particularly damaging for those who already may be respiratorily compromised via asthma, COPD, or what have you. So this is a very important issue, and intensifying urban heat islands are intensifying the issue of surface level ozone. Now, again, the really cool thing is that NASA has a satellite that we launched last year called TEMPO. And TEMPO is in an orbit called geostationary orbit. And that means that it's constantly staring over the same area of the Earth 24 hours a day. And for TEMPO, that area is North America. And so every day during the daylight hours, TEMPO, every hour of the day, is taking observations of nitrogen dioxide at an unprecedented spatial scale, down to the neighborhood level across the United States. So we're able to provide this information to our partners at the EPA or the National Oceanic and Atmospheric Administration, where we're now being able to see how air pollution, where the sources are of it across the country, how it changes during the day from AM rush to PM rush, and how it moves across the country, because air pollution doesn't respect any state or international boundaries. It moves along with the wind. So it's been a really fascinating and revolutionary instrument that we recently launched, like I said, just a year ago, to help us understand where the issues of air pollution are across the country.
And Helena, so scientists and physicians, like, using this data from NASA, are scientists able to, like, predict and model diseases like cholera or, we touched on water quality, but are they able to say like, hey, we need to warn this country because the way the weather system is evolving, and the way the climate's been evolving, they're going to be at risk for an outbreak of something like that?
Yes, exactly. And I think that part of it, looking at the health professional community as a whole, is that being able to understand that connection, we think, between climate change and some of these different, vector-borne disease behavior, among even some of those air quality trends that John had alluded to, being able to can help us not only with, most importantly, with our health education to patients and to community members, which is the fundamental, pillar that will stay in that community, but also help those who are practicing to be able to provide those, robust diagnoses, treatment, and prevention plans. Aside, as we know from some of the vector-borne disease statistics, we're seeing more. Several years ago, when I was in my master's program, the statistic we always used for those communities, those tropical and subtropical areas at risk for dengue transmission, was about 2.5 billion people. Well, now we're looking at that number being 4 billion, right? Because some of those temperatures are now increasing some of the vectors. They like those warm habitats to be able to flourish and have those mosquito breeding sites. If the virus or the other pathogen is there and the vector is there, then you have an increased risk of transmission. But there are many factors that have come to play. And we think about vector-borne, but even looking at cholera, as you had mentioned, cholera is a tremendous challenge across the globe, especially because it is underreported. There is a very high, large confidence interval of being able to identify really what some of those cases are and where they're occurring, and what are some of those driving factors where it can flourish. Just because it floods does not mean there'll be a cholera outbreak. Many conditions have to come into play. And one of our NASA-funded research has been working with cholera for decades, being able to look at different geographies, and more recently has been able to expand some of the work done in Bangladesh to when Yemen had the world's worst cholera outbreak in 2018. Being able to call to that to identify, can we do something more with some forecasting, or what we might call risk maps? Now, as a clinician, if you have a risk map and out of, let's say, 10 counties, that 2 of them are going to be at high risk or are predicted with a higher risk, instead of allocating sufficient resources for all 10 counties or 10 sectors, now you can really hone in on those 2, in addition to some of the work in the other areas to prevent some transmission. So that is extremely important from someone who's working at the community level or from the policy angle to have some of these risk maps. Dr. Anta Jutla at the University of Florida, coincidentally, he has been working from the work in Yemen, being able to provide those risk maps with about 90% accuracy. And so from there, his team has been able to provide risk maps with 4 weeks of anticipated notice to decision makers upon request for that area. And now that has expanded to more than 10 countries, including many countries in Africa, upon request again of some of those areas such as Malawi or Ethiopia. And being able to provide that to decision makers to identify, hey, there might be a higher risk in these areas of the country. So again, that information can be valuable because we tend to respond to outbreaks or disasters instead of preparing for them appropriately. Traditionally, some areas are better than others, some disciplines are better than others. But if we can be able to maintain that information ahead of time, then we can prepare our hospitals or prepare our community health workers to be able to have that information beforehand, especially if there might be door-to-door visits or being able to work directly with community members.
And then do they ever reach out? Like we touched on, like upon request, they can get that data, but sometimes they don't know what they don't know. Is it ever like where the science team is saying, oh, there's going to be a dengue outbreak in a certain location, we probably should reach out to their government or their health department? Are there cold calls like that for warnings?
Yes, in this case, the researchers are working directly with those decision makers and those individuals who will be working directly with those areas, maybe a humanitarian agency, maybe a non-governmental organization. So that's part of the robust aspect of some of the NASA-funded projects, is the requirement not only of being able to use satellite data, but also making those valuable community connections so that information can be put into the hands of those individuals who need that information. For example, some of the work, I know we may talk about dust storms during this, because that is something that we're seeing also expand in different areas, right? We have dust storms in the southwest of the United States. We're seeing it also from the Saharan dust plume crossing the Atlantic Ocean and affecting the Caribbean basin, for example. And so some of those aspects, be able to provide some of those air quality monitoring forecasts can be able to help provide that information to, hey, this is going to be coming, who's the population who might be more vulnerable or at risk, to be able to provide, again, that information. But that would be primarily with those individuals who are making decisions or who have that expertise. For example, in Puerto Rico, they actually named the Saharan dust storm part of their emergency as part of the Department of Health. And so that is, of course, they work directly with community members to be able to provide that information, and so that communities can understand where the resources are in case there is a heat wave, in case there is a dust storm, in case there's a vector-borne disease outbreak, for both education, but also resources.
And that was the desertification was going to be my next question. I'm glad you touched on that because those dust storms have grown more intense, it seems also. And so, we hear the arguments going back and forth that the Earth goes through normal geological evolutions, ice ages, et cetera, naturally. But what, in your mind, what evidence separates the human contributions? And what are like your top data points where you say, hey, these are things that we could be doing better that are affecting this?
Well, let's just to the first part of your question. Since the Industrial Revolution, when we began burning fossil fuels and causing emissions of greenhouse gases in our atmosphere, essentially all of the observed warming that we have recorded, both through ground measurements, ocean measurements, and satellite measurements, essentially all of the observed warming is due to human activities. Yes, of course, as we all know, the Earth has gone through natural cycles in the past, and there are many natural cycles that, of course, are continuing to go on the Earth right now. For example, El Nino and La Nina, and there's also slight variations in solar radiation as the sun goes through its minimum and maximum cycles. But none of these natural cycles explain the amount of warming we have seen over the past 150 years. It just doesn't, the math doesn't work out. The only way you can explain the amount of warming that we've seen over the past 150 years, which we estimate to be about 1.5 degrees Celsius, approaching 1.5 degrees Celsius warming over that time since the beginning of the Industrial Revolution, can only be explained through the addition of greenhouse gases to our atmosphere.
And that's the aggregate, the global temperature increase.
That's the global temperature. That's the aggregate. That's the aggregate across the globe. So just to give you some examples recently, 2023, according again, not only to ground measurements, but again, NASA satellite data, along with our partners who both domestically and internationally, like the European Space Agency satellite data, NASA researchers were able to confirm 2023 was the hottest year on record that we have for this planet. And if you really want to dig back, which there's people called paleoclimatologists, who they go back and they look at ocean sediment cores, tree rings, ice cores from Greenland and Antarctica, where we can reconstruct climate going back hundreds of thousands of years. It may likely have been the warmest year on this planet in 120,000 years, if you look at paleoclimatology.
Wow.
For 13 consecutive months, from June 2023 to June 2024, each month was the hottest the Earth had ever seen on record for 13 consecutive months. Last month, on July 21st, NASA satellite observations confirmed that July 22nd, it was July 22nd, 2024, based on our global satellite information from NASA, was the Earth's hottest day on record. So again, the evidence is now overwhelming that the Earth is warming dramatically, that human activities, primarily through the burning of fossil fuels, is the primary and overwhelming contributor to this issue. And one of the things when we talked a lot about air pollution, but just to briefly touch on another subject that sometimes, gets lost in the mix when you're talking about extreme weather. Extreme weather events are a big, of course, public health burden, not only for the direct injuries and deaths that they cause, but also due to the crippling of infrastructure, particularly health infrastructure. So going back into my background in meteorology, for example, we can talk about hurricanes. For, this year, Hurricane Beryl, for example. Hurricane Beryl was the earliest Category 5 hurricane on record that we've ever had in the Atlantic Basin. Now, when it entered the Gulf, it weakened, but as it approached the coast of Texas, it underwent something called rapid intensification. And we're seeing this more often over the past 20 years as hurricanes approach our Gulf of Mexico coastline, likely because of the high heat content of our oceans. We are seeing record high ocean temperatures, not just air temperatures globally. And the Atlantic Basin is supercharged right now with extremely record-breaking warm temperatures, including in the Gulf of Mexico. So this is one of the key ingredients that helps hurricanes become stronger and undergo rapid intensification. So as Hurricane Beryl made landfall in the greater Houston metropolitan area, it was undergoing this rapid intensification, even though it was only a Category 1 hurricane. But storms that are undergoing rapid intensification are much more dynamic, and they're able to bring higher wind speeds to the ground in a much more efficient manner. So what we saw was Houston just complete electrical infrastructure devastated for weeks with, I think, 1 million plus without power. And of course, the nursing homes, the medical facilities, I mean, that is a huge crushing blow to them when you're talking about multi-days to weeks without power, not to mention flooding that is cutting off people's access to be able to get to medical facilities or cutting off access for emergency personnel to be able to reach them. And so from this Category 1 hurricane, we estimate that the damage, it has been estimated that the insured losses from that was upwards of $4.5 billion. And, we unfortunately, NOAA, as well as other partners across the country in meteorology, are recognizing that a lot of ingredients are coming together this hurricane season, including that really supercharged high ocean heat content, that we could be entering a very dangerous hurricane season, because hurricane season doesn't reach its peak to mid-September. So we're kind of getting in that ramp up. And so in a globally warmed world, when you have these higher oceanic heat contents, that allows for storms that's one of the ingredients that can allow for hurricanes to intensify more rapidly. Plus the flooding, the extreme rainfall events. A warmer atmosphere holds more water vapor, which has to come out as rain or snowfall. And so I don't think you can turn on the news over the last year, 2 years, where you don't see some once in a 100-year, once in a 500-year flood hitting areas like Ellicott City, Maryland, or Miami-Dade County, Florida, or Fort Lauderdale, Florida, or in California. And those once in a 100, once in a 500-year floods, well, they're coming on more and more often, because again, in a globally warm world, the atmosphere is able to hold more moisture, but that can lead to extreme flooding events as well, which is another, of course, big human health impact.
Mm-hmm. It is. And Helena, in your mind, what steps can individuals and communities take to protect their health in the face of this extreme heat, these extreme flooding events, the fires?
Yeah, I think first and foremost is learning more about the effects of climate change and how that can impact you personally. Sometimes, and that's going to require maybe asking questions with scientists, maybe going to some different community forums. Oftentimes, different events throughout the year are part of a community. For example, our team was able to help support some of the UNEP local events. John was a speaker at a community event talking about air quality concerns for the International Day for Clean Air and Blue Skies. So being able to connect with your community members and identify maybe some of those events to be able to learn more and ask the experts who are working, that's their bread and butter every day. The other thing is making sure that you're connecting with your primary healthcare physician or nurse practitioner to be able to identify and ask questions, because they're also experts in those areas, not only the health, but they're also being aware of what some of those community risks are. Maybe with this season, making sure we always think about getting your flu vaccine. Well, when we come into certain seasonal temperatures, there may be increased risk for mosquitoes. And so from that, if the pathogen is there, then there may be higher transmission of certain diseases. But basically also understanding the personal risk, but knowing where the community resources are. Are there cooling centers in the community? Are there other resources within the health department? Are there neighbors? Sometimes, communities are able to help others in identify where some of those community resources are that can help when we think about extreme heat. But also if we think about disaster preparedness, do we know where we could go in case the hurricane is coming? And many of the local health departments offer those resources and bring that across to those communities who may need that information. So definitely starting out and getting some information from those experts, whether those are the scientists working on it, but also your own, primary care provider.
In Jacksonville, we have a critical care shelter where people with LVADs, who just absolutely have to have power. It's a critical care hurricane shelter that will remain relatively climate controlled and is staffed by physicians. And so there, I'm hopeful that most communities have that, but it's definitely out there where there are options available to get care and to have resources available to you in those disasters.
And I was just going to add for us city dwellers, when you talk about acting locally but thinking globally, and that's absolutely very true. Going back to the urban heat island, and our urban heat islands becoming more intense as heat waves become more intense and longer lasting, there are things that people can do and also work with their city leaders to do to not totally mitigate. You can't totally mitigate that issue, but on the margins can help try to cool our cities. For example, adding more green space to our cities, particularly in the urban core. A lot of areas are experimenting, for example, with adding rooftop gardens or painting the rooftops of buildings in a very high reflective paint to reflect solar radiation back instead of absorbing it. Also, again, it's an individual thing, but urban gardening is really taking off, and that helps, add to green space. I know my husband right outside here on our balcony has his urban garden with his herbs and tomatoes and peppers, and that all helps to add green space, which does help to cover up some of our asphalt concrete to help try to mitigate some of that urban heat island. Another thing that cities are experimenting with is called cooling pavement. Actually building roads or putting a coating on roads that, much like what I was talking about with rooftops, will help reflect solar radiation because our cities are just covered in black asphalt. But as temperatures continue to rise, we talk a lot, of course, about the heat stress impact on health of high temperatures. But another issue with this has come to play in recent years that probably people, I know I hadn't really thought about. Last month, for example, Las Vegas, Nevada had a record all-time high temperature of 120 degrees. Phoenix, Arizona has had multiple record high temperatures set this summer. We are seeing coming into emergency rooms in Las Vegas and Phoenix, for example, more and more people who have suffered severe burns because they came into bare skin contact with pavement, asphalt, or concrete, either by falling or maybe it's our unhoused populations where they were having second or third degree burns, literally from touching the asphalt, touching the sidewalks. And we've been actually able to measure street temperatures, surface temperatures from one of our satellites, from one of our sensors on board the International Space Station known as EcoStress, to be able to see how hot are these surfaces getting in our cities. And sometimes they're upwards of 140, 50, 60 degrees. And as we continue to suffer these more extremely intense heat waves, that's another health issue that is coming to play, not just the stress from the air temperature, but people actually being injured by coming in contact with materials on the ground that are literally as hot as your stove in your kitchen.
Yeah, the physical burn, I mean, you can fry an egg down there. And so it's pretty easy. So as an individual, it's pretty easy to feel insignificant and powerless. You're one in billions, so what can I do? And we talked about a few things like rooftop gardens, community gardens, painting your rooftop white. What are some other easily deployable or not so easily deployable, but what can the everyday non-activist working person just trying to support their family, what are some small changes or big changes, but what are some changes that person can make to mitigate this?
Well, I think again, it kind of depends on your, you can find a role in either. There's two ways that we can deal with climate change. I'll start there. There's two ways we can deal with climate change: mitigation and adaptation. When we say mitigation, we're meaning reducing emissions and stabilizing the levels of greenhouse gases in the atmosphere. That's a lot when you hear people talk about getting to net zero carbon emissions. Then there's adaptation, adapting to the climate change that's already here and already in the pipeline. And that can be things, for example, for people living in hurricane-prone areas, building houses that are taking into account not only storm surge from more intense hurricanes, but the sea level rise that has already occurred due to melting glaciers and ice sheets, and that will continue to occur through the 21st century when you're deciding where to build a home, using materials to build that home that are of maybe stronger construction. When you're talking beyond a personal level, cities building seawalls, building pumping stations to pump water out of cities that are becoming flooded more and more often. So people can find a role either in the adaptation or mitigation side that fits their skill set, from helping share the importance of decreasing greenhouse gas emissions through their own personal lives, electric vehicles and so forth, to working with their local community and their local community leaders to help prepare for the extreme effects, and advocating for, where maybe in their communities better drainage needs to be, for example. So it kind of depends on the person and where they live and what their skill set is on how they can work with their own community leaders to help address this issue.
And Helena, we touched on it, but I want to revisit it for our listeners. Like, how can healthcare professionals, scientists with no grant support or a budget, like me, but how can they use that data that's on that free access from NASA to do their own evaluations and to better understand and address the health impacts of climate change in their practice, or if they have a question they want to try to answer for themselves? Is it earth.gov?
Sure. Earth.gov is the Earth Information Center that provides the information at a level that we can use for our health education messages. When we do any of our talks, I always tell many of the students and professionals and target audiences, just put a visualization of one of these NASA, 30-second where you can actually see the air quality, especially from some of this tempo data that John had mentioned. You just put a 30, 60-second animation on a slide and saying, this is the nitrogen dioxide concentrations that we're seeing especially across the urban pockets across the US. It is eye-opening. We call it eye candy, because there is no interpretation. It's the satellite collecting data, and it's directly downloaded and put onto a very nice animation where you can really see where the areas that have higher concentrations of nitrogen dioxide or not, or if we see higher levels of precipitation or higher levels of vegetation. Those can be proxies, for example, vector-borne disease, and some of the work with the research applications related to that. As far as getting involved, I would say that those are great start points. Again, many health professionals are not going to go back to school to get another master's or PhD, maybe so. But this is a great opportunity to take some of those RSET classes, kind of become familiar with the jargon. I've had to do the same. Gain a little bit of that jargon so that you can use that. There are also different certificate programs on different GIS and remote sensing that might be an option that's not a complete degree if someone's interested in gaining those advanced extra skills. The Develop program is also an internship that anyone can apply for to be able to work in groups to use some of this remote sensing data into a community application that is of need, whether it's air quality, it's a biodiversity, it's a disasters. Another opportunity is for them to serve on grants with other earth scientists. Many of the earth scientists, for example, when they're responding to different grant opportunities within the federal agencies, including NASA, many of them don't have clinicians on board, but their topic is relevant to the health community. So clinicians can serve as another voice for that holistic perspective, to be added as a collaborator, a contributor, or a co-I on any of these and any potential solicitations. And also get involved in some of these community events. For example, Earth Day is on April 22nd. It's a great opportunity to become involved and bring in some of the health community in some of those activities.
And so for people, like, are there any internships or experiences where you look at that and you say that was kind of my pivotal moment, or that was what shaped me as a scientist or physician?
I guess the internship, I would say, is the one that brought me to NASA, which was the AAAS, the American Association for the Advancement of Science and Technology Policy Fellowship, which basically provides an immersion with a federal agency for 1 to 2 years. And I had the honor of being able to contribute to the health and air quality applications within our program for our science division. And so that was pivotal for me because I had been working with mosquitoes, with sputum samples in the field, working with community members as well as clinicians in communities and hospital settings. And I was able to expand my toolkit, my One Health toolkit, which I like to call it. So now I get to add remote sensing and different earth science applications that were never on my radar and are now constantly on my radar as another toolkit. It's not the answer to everything, but it provides another piece to the puzzle when we think of a global health challenge. And so that opened up my ideas. I went from clinical guidelines to now looking at different types of policies within earth science and how to be able to mesh those. So I was still working in policy before NASA, just in a clinical guideline were my policies. So it provided an opportunity to expand, again, my toolkit. And I encourage all your listeners to be able to look toward, earth.gov, to look at some of the NASA data sources, the RSET courses, to really add that to your repertoire so that it can help us bring some of the messaging to those, to the people who need that information, whether that, again, that is our patient or whether that's the mayor of a community.
And we have a wide variety of internships available at NASA that if you just Google NASA intern, you'll get to the website. We also have a special program in NASA Earth Action called Develop, where I believe that they do 3 sessions a year. Each session's about 10 weeks, and it's open to undergrad, grad students, continuing education students. A competitive program where I think this summer there was over 100 students who were involved, who over the 10 weeks, they worked directly with NASA scientists and community leaders and decision makers to help apply Earth science satellite data to a local problem. And then they get to present their work after 10 weeks at a big showcase at NASA headquarters. So that's another really good way for our next generation to get involved. And I would be remiss, since Helena plugged the AAAS Fellowship, if I didn't plug the way I got into NASA, which was the Presidential Management Fellowship, PMF, which is a program run out of the U.S. government's Office of Personnel Management. And it's open to all graduating master's and doctoral students to apply for that program. It's a competitive program that places you, if you get through the process, places you in a federal agency for a 2-year fellowship. And at the end of the 2-year fellowship, if you want to stay on and your agency is happy, you convert over to civil service. And that is how I entered NASA back in 2002 and still there 22 years later.
That is amazing. And I love that. It's really important to get young people involved. And so
Absolutely.
I like to highlight the opportunities for the very young all the way up to continuous learners. Even as adults, we're always learning. And I love that. Thank you both so much. And so what's the best way for people to find out more about what you two and NASA and the One Health concept are doing for the health of our planet? Like what's the go here, or follow us on Instagram, or where do people find out more?
Well, the number place, I'll say the number 1 and number 2 places is Helena's already mentioned earth.gov. And that's our Earth Information Center. So I do encourage people to go there. And if they're in the Washington, D.C. area, they can not only visit our physical Earth Information Center at NASA headquarters, but a new, larger and more advanced and expanded Earth Information Center will open in October at the Smithsonian Natural History Museum. So that will be another opportunity. Also, if they want some details on all of the 25 plus projects that we're currently working on across the nation and the world, visit our website at appliedsciences.nasa.gov. And they can also provide feedback through a link on that page directly to us if they want to get involved. And hopefully we can help link them up with people in our health and air quality community who could help answer their questions as well.
Oh, wonderful. Okay, appliedsciences.nasa.gov.
Yeah, and another opportunity is if you happen to be going to any conferences, see if there's a NASA exhibit or a NASA booth. Oftentimes we will be bringing the NASA Hyperwall is available, where there are science talks on top of this, what we like to call a television screen on steroids, where the animations really come across vividly, and to talk with NASA scientists and other researchers and staff to learn more about different types of NASA programs. There are many conferences throughout the year. And if you don't see it in the exhibit hall, see if there's a NASA session, because we are trying to reach out across in Earth Action to go to those stakeholder meetings and conferences where it's not the typical earth science or space-based conference. They are the health or the agriculture or the ecology. So encourage you. And if you see us, come by and say hello.
100%.
Yeah, we will. And we will definitely be for the public health and medical community. We will definitely have an exhibit and the Hyperwall coming up at the American Public Health Association conference in Minneapolis in October, and then the American Thoracic Society conference next May. So we'll definitely be there with the Hyperwall.
Wonderful. Any last words of advice for our listeners?
I would just say learn a little bit more about the One Health concept. Think about how your work can contribute and reach out. This is a great opportunity right now. We need innovation. The WHO came across with 13 urgent challenges a couple of years ago, and one of them is harnessing new technologies. And to me, I interpret that as new ways of doing things. So to me, satellite data is innovative. To John, it's not, especially for our disciplines. But for me, how can we use it in ways that we hadn't thought about it? So something that may be around. The WHO is referring mostly to telemedicine and digital technologies, but think about how you work, what's your bread and butter every day, and how can we modify that? Talk to someone of a different discipline to see how they think about that question, because together then we can be able to build better questions, more sophisticated questions to come to advancing science, and that comes together. So we can all contribute in this One Health community by leveraging our expertise and collaborating together.
Well, you heard it, folks. Earth.gov, NASA.gov, appliedscience.nasa.gov. Thank you to John Haynes and Dr. Helena Chapman for joining me today. I really appreciate having you here and your expertise. It's been incredibly informative for me, and I'm sure our listeners as well. And I'm so grateful for your time.
Thank you so much, Sarah. It's been a pleasure.
Thank you, Sarah.
And for our listeners, I'm so glad to have you as part of the Extreme Medicine family, and I hope to see you at one of our courses or the annual conference in November. Thank you.
Thanks for listening to the episode. Please feel free to rate, review, and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical, and performance medicine. Thanks again.